How have you guys been and how are you doing? I welcome you all to another edition of Did You Know? If you are just joining for the first time, welcome you. And if you have been here, you're watching the show, I welcome everyone. How have you guys been and how are you doing? The last time I talked about eating disorder, if you are yet to watch that video, please make sure you go back. Don't just watch, don't just learn. Tell a friend to tell a friend, and let's share the knowledge together. Today I'll talk about ectopic pregnancy. Yeah, I got inspired by the topic because I feel like the topic is a little bit interesting and I feel like it is what every woman out there should be aware of. So, still, I'll be back soon.
I'ma make you pump like that. Make you pump like that. Make you pump like that. Make you pump.
So welcome back guys and let's get started. I will try my best to break it down to the simplest level and make this video very short. So let's get started. Ectopic pregnancy. Every pregnancy begins with a fertilized egg, and this fertilized egg attaches the lining of the uterus. The uterus is where the growing baby stays. However, an ectopic pregnancy occurs when the fertilized egg grows and implants outside the main cavity of the uterus. However, this pregnancy can't continue as normal because the fertilized egg can't survive. And if it is left untreated for a long period of time, it might endanger the woman's life. People also ask that what are the symptoms of this ectopic pregnancy? A woman with an ectopic pregnancy will still experience the normal early signs and symptoms of the normal pregnancy, such as the missed period, the breast tenderness, and even when she goes for a pregnancy test, it still comes out as positive. But however, this pregnancy can't continue as normal. And as time as the fertilized egg stays more in the fallopian tube, the more the signs and symptoms become noticeable. And this fertilized egg might also stay in other areas of the body, such as the cervix. That is why it is called an abdominal or tubal pregnancy. People also ask that what causes this ectopic pregnancy. Ectopic pregnancy, like I said, is also called abdominal or tubal pregnancy, and it occurs when the fertilized egg is tucked in the fallopian tube. That is why it is a tube. A fallopian tube is like a passage. It collects the egg produced by the ovaries and takes it into the uterus. A fallopian tube is a passage which collects the eggs from the ovaries and take it into the uterus where it grows as a baby. So this ectopic pregnancy occurs when the fertilized egg is tucked in the fallopian tube, when it can't leave the fallopian tube. That is why it is called an ectopic pregnancy, and it occurs because the fallopian tube is damaged by inflammation. It can also be caused by hormonal imbalances and abnormal development of the fertilized egg. People also ask that what are the complications? When this fertilized egg stays more in the fallopian tube can rupture. And whenever it ruptures, it starts to leak. The fallopian tube starts to leak. Blood starts to come out of the fallopian tube, which leads to the symptoms that a pregnant woman will notice if she has this ectopic pregnancy. She will start to see light vaginal bleeding. Her vagina will start bleeding lightly. She will experience an unusual shoulder pain. Then she might start to faint and experience more of shock. Please, when you start to get the signs and symptoms, it's best to seek a medical advice or help as soon as possible. People also ask that what are the risk factors that might cause this ectopic pregnancy. It can be caused by a previous ectopic pregnancy. If a pregnant woman has once had this kind of issue, it might reoccur. Also caused by inflammation or infection. When people have a sexually transmitted infection such as the gonorrhea and the chlamydia, it tends to inflame. It leads to inflammation of the fallopian tube, which increases the risk of an ectopic pregnancy. We also have fertility treatments. Some research suggests that women who have undergone this in vitro fertilization, which is called the IVF, are more at a open risk of having this ectopic pregnancy. And smoking. If you are about to get pregnant, it's best to quit smoking because the more you smoke, the higher the risk. People also ask that what is the prevention? For now, there is no prevention, but you can reduce or decrease the risk of this ectopic pregnancy by limiting the number of sexual partners and making use of a condom during sex to prevent this sexually transmitted disease or infection that might lead to the inflammation of the fallopian tube. Then quit smoking. If you do smoke before you get pregnant, once you're about to get pregnant, quit smoking. So, everyone, that is all about ectopic pregnancy. I hope you guys learned a thing or the other. I hope you guys can, tell it to someone ectopic, what ectopic pregnancy means and how they can prevent it and what causes it. So if you are a pregnant woman, like I said, the symptoms does not show very early. You might still think you have carrying a normal baby until it stays longer and you start noticing like the vagina will start bleeding. You have this unusual shoulder pain and you start to faint. Please make sure you seek medical help and advice. If you are a lady, if you're a woman, please don't keep this video to yourself. Share it to other women and let's share this knowledge together. Tell a friend to tell a friend to tell a friend to tell a friend, and let's spread this knowledge together. From your favorite girl, I love you guys now and always. Thank you for listening. Thank you for watching and staying to the end. I love you. I'll catch you again some other time. Bye, y'all.